I'm Theodora Scorato, Executive Director of Environmental Health Trust. We are a scientific think tank focused on publishing research, educating the public, and educating policymakers around the world about environmental health. Hundreds of scientists are calling to halt 5G. They are calling to halt the deployment of hundreds of thousands of new wireless antennas, which will be placed directly in front of our homes, our schools, where we live, play, and work. The people are listening to these scientists, and they are calling on their elected officials to halt 5G to protect human health as well as the environment. The fact that over 600 municipalities in Italy have taken action calling for safety before the deployment of 5G is absolutely inspiring us in the United States and around the world. People have been protesting for years to halt 5G. Here's video footage from Amsterdam, Australia, California, Brussels, South Africa, Italy, New South Wales, Australia, New Zealand, Greece, Cyprus, Spain, England, Peru, France, in the United States. This is in Oregon. This is in Hawaii. Since 2018, members of Congress and elected officials have been sending letters to the FCC asking for 5G safety data. They include Senator Richard Blumenthal from Connecticut, Representative Anna Eshoo from California, Representative Peter DeFazio from Oregon, Representative Andy King from New Jersey, and Representative Thomas Suizo from New York. The letter sent from Senator Blumenthal and Representative Anna Eshoo states, "We respectfully request you provide to our offices the 5G safety determination from FCC and relevant health agencies." As another example, New York State Senator James Garan stated in his letter, "We are also concerned with the long-term 24/7 exposure to 2G, 3G, and 4G that are currently in our neighborhoods. The health of our community is of utmost concern and cannot be sacrificed." In response to all of these inquiries around the safety of 5G, in 2019, the US FCC, quite shockingly, decided to maintain their 1996 human exposure limits for wireless and cell phone and cell tower radiation. They're very similar to the limits of the International Commission for Non-Ionizing Radiation Protection, in that they are non-protective, they are based on outdated science, they're based only on short-term heating effects, not long-term effects or biological effects, and they're really based on science that go back decades from the 70s and 80s. They also only look at power level, but they don't look at more complex aspects of an exposure, such as modulation, polarization, and data rate. Environmental Health Trust, as well as numerous public health experts and scientists and citizens around the United States, as well as internationally, had submitted to the FCC research showing harm at levels far, far lower than FCC limits. Yet the FCC still decided to maintain these non-protective, irrelevant, and inadequate limits. We filed our legal appeal last year and had our court hearing last month. The judges asked very pointed questions of the US FCC, questions that showed us that they had read our brief. They asked about cumulative exposure, about kids using laptops on laps, about the Internet of Things and all of the wireless devices and networks that people are exposed to today compared to decades ago when those limits were first developed. Now, the US FCC has also proposed new rules related to the higher frequencies that will be used in 5G. Those new rules set exposure limits, which are again non-protective because they don't protect from long-term exposure or biological effects. There were many expert responses, including a response from the city of Boston, Massachusetts, regarding 5G. Let me read part of their letter. Research has revealed that there may be concerns with possible health effects of low-level multiple source exposure arising from the huge diffusion of communication technologies, such as mobile communications, wireless data transfer, such as Wi-Fi, WiMAX, Bluetooth, and Zigbee, and the wireless networks to which these devices connect. Therefore, Boston requests that the Commission also examine the potential impact on the health of low-level multiple exposures. And that's a letter from 2020. Now, across the United States, there are numerous actions happening at the local level. There are council resolutions to halt 5G at Keene, New Hampshire, Hawaii County, Hawaii, Easton, Connecticut, Farragut City, Tennessee. There are resolutions regarding the health and environmental effects of 5G from Hillendale Beach, Florida, Coconut Creek, Florida, Carmel City, Indiana. They're calling for a review of the research before we deploy this technology onto people and the environment. And there are many resolutions calling for changes to federal law so cities can control 5G, such as in New Jersey City, New Jersey, and Oak Brook, Illinois. These are only a few examples. There are many cities that are passing ordinances to restrict and control 5G small cells. They include Los Altos, Petaluma, Mill Valley, Malibu, Santa Barbara, Nevada City, Calabasas, San Clemente, Westlake, Sonoma, Sebastopol, San Rafael, Ross Valley, Encinitas, Fairfax, Palo Alto, Walnut City, and San Diego County, California. Copake, New York, Warren, Connecticut, Lavallette, Florida, and Mason, Ohio. Each city has its own unique ordinance meant to allow the people to be part of the decision-making process. In Los Altos, California, for example, their ordinance says that the installation of small cells on public utility easements in residential neighborhoods is prohibited. A small cell is a shorter cell tower with 5G and 4G antennas on it. There's a 500-foot separation from schools. There's a 1,500-foot separation between nodes, between the antenna facilities. Many cities have a specific amount of feet that a cell tower or small cell 5G wireless base station must be from a school or home. So for example, in Calabasas, it's 1,000 feet, Petaluma, 500 feet, San Ramon, 300 feet. Walnut, California, and Hampstead, New York have a 1,500-foot setback for cell towers from homes. Palo Alto, California, and Bar Harbor, Maine, as well as Sallisaw, Oklahoma, have 1,500 feet setbacks from schools. Stop 5G International has video footage from the protests in Berkeley, California, where people have been protesting cell towers, and there have been arrests and many other actions going on in the city. The International Association of Firefighters has an official position against cell towers on fire stations. And in the United States, California firefighters have long opposed cell towers on their stations. This announcement was released by firefighters in Los Angeles, telling them to call on the Board of Supervisors and stop the cell towers that would be forced on top of their stations.
Firefighters living and working beneath cell towers like this one have gotten sick. Headaches, extreme fatigue, memory loss, and brain scans show that firefighters exposed to toxic RF radiation experience cell death, ALS, Alzheimer's, and Parkinson's disease. Now, the Los Angeles County Board of Supervisors has approved cell tower installations on fire stations in neighborhoods like yours. Call the Board of Supervisors and tell them to stop the cell towers now.
Los Angeles County Firefighters Local 1014 had a webpage dedicated to stopping cell towers because of a plan to install them on their stations. And they have testified at many meetings calling to halt cell antenna placement on top of their stations. The American Academy of Pediatrics is the largest medical organization of children's doctors in the United States. They recommend that children's exposure to cell phone radiation be reduced, and they actually have issued 10 ways to do that on their website, Healthy Children. They also have a website page on electromagnetic fields where they talk about cell towers, and let me quote what they say. In recent years, concern has increased about exposure to radiofrequency electromagnetic radiation emitted from cell phones and cell phone station antenna. An Egyptian study confirmed concerns that living nearby mobile phone base stations increase the risk for developing headaches, memory damage, dizziness, depression, sleep problems. This medical organization has repeatedly written the US FCC, calling on them to update their limits for allowable levels of wireless radiation and calling on them to protect children. The Los Angeles, California Public School District has a resolution banning cell towers on school campuses. And in addition, the District Office of Environmental Health and Safety also states that they have a precautionary threshold level that addresses non-thermal levels, and their threshold is 10,000 times lower than the FCC standard. They state it is believed that a more conservative level is necessary to protect children who represent a potentially vulnerable and sensitive population. Now, although they have a resolution banning cell towers on school grounds, there are many teachers who are in the process of or who have filed action against the school district. They've been injured by the Wi-Fi. Some have been accommodated and others have not. They are, as I understand it, just averaging the wireless radiation levels, which is not accounting for biological effects. In fact, there was a critical win in court by a teacher who filed against the school district, and her court case is now going to be allowed to proceed. And we will be watching this case very closely. I now want to speak to you about an extremely important report released from the New Hampshire Commission on 5G and the Environment. They issued a final report after 1 year of investigation into 5G. There were presentations by expert scientists, including the National Institutes of Health. On the commission were engineers, scientists, and medical doctors, and elected officials. Their final report details 15 recommendations to the state to protect the public. I'm going to summarize some of their very important recommendations. They recommend there be an independent, not wireless industry-funded study on 5G health effects. They recommend an environmental assessment on the impact of 5G. They call to engage federal agencies with ecological knowledge to develop wireless radiofrequency radiation safety limits that will protect trees, plants, birds, insects, and pollinators. They're calling on the state to have setbacks so that there is a distance between cell antennas and schools and homes. They recommend that measurements be taken of the radiofrequency radiation levels, especially near homes, and have this information posted publicly on maps that people can access to see how much radiation they're being exposed to every day when they're outside or near their school or near their home. They're calling for 5G structures to be labeled for radiofrequency radiation, and that should be at eye level so people can read it up to 9 feet away from the 5G antenna system. They are also recommending the establishment of wireless-free zones. And they are calling on the medical community to develop protections and protocols for people who are being harmed by non-ionizing electromagnetic radiation. As an example of what is possible, what you're seeing here are pictures from the Archbishop Makarios Hospital in Cyprus, which has removed Wi-Fi from the pediatric and neonatal units. I was honored to present a premiere of a video by the National Committee for Environment and Children's Health of Cyprus, where they showcased how they remove the radiation. They're educating the parents and the staff, and the medical doctors are taking action to protect their patients. Here's a short clip from the video, which is online.
Τα παιδιά και τα νεογνά, ιδιαίτερα τα πρόωρα, είναι πολύ ευάλωτα και πρέπει να τα προφυλάξουμε. Γι' αυτό, βασισμένοι στη διεθνώς αποδεκτή αρχή της προφύλαξης, στους θαλάμους εντατικής θεραπείας παιδών και νεογνών του Μακάριου Νοσοκομείου, αποσυνδέσαμε το Wi-Fi. Χρησιμοποιούμε μόνο ασφαλές ενσύρματο διαδίκτυο, συμβουλεύουμε όλους όταν πλησιάζουν τα παιδιά να βάζουν τα κινητά τηλέφωνα τους σε λειτουργία πτήσης. Έτσι, φωτογραφίσουν και διασκεδάζουν τα παιδιά με μουσική και βίντεο, χωρίς να τα εκθέτουν σε επικίνδυνη ακτινοβολία. Γιατί τα παιδιά έχουν δικαίωμα στην υγεία.
Η υγεία είναι δικαίωμα. Είμαστε στερείτε.
Είμαστε περήφανοι για την πρωτοποριακή αυτή έρευνα που γίνεται με την επιστημονική καθοδήγηση και συνεργασία της Εθνικής Επιτροπής Περιβάλλον και Υγεία του Παιδιού. Καταφέραμε να μειώσουμε την έκθεση στην ακτινοβολία σε αποδεκτά επίπεδα ασφάλειας και θα συνεχίσουμε.
Μαζί δείχνουμε το δρόμο. Και το μακάριο νοσοκομείο εξελίσσεται διεθνώς σε μια πρότυπη όαση υγείας και προφύλαξης των παιδιών από την ακτινοβολία.
And in the United States, there have been 2 large medical conferences to educate doctors about the health impacts of electromagnetic radiation and wireless radiation, as well as how to treat people who have been injured by wireless radiation. There was a medical conference in 2019, and just recently a 4-day conference in January of 2021. All of the video recordings from that conference, which was entitled Prevention, Diagnosis, and Treatment of Electromagnetic Fields Associated Illness, they are all going to be online to train medical doctors across the world. The New Hampshire Commission on 5G and the Environment also recommends that the public's exposure to radio frequency radiation be reduced. They're calling for software changes on wireless devices so that they'll reduce radio frequency radiation when they get close to the body. They're calling for a multimedia campaign by health agencies to educate the public on how to minimize radio frequency wireless cell phone, cell tower, Wi-Fi radiation, especially for newborns and pregnant women. And they want radio, print, television to be used in this multimedia campaign. Parents need to be made aware of the risk to their children and their families from this radiation. 5G is going to increase our involuntary exposure to wireless radiation. Even if we're not using a phone, we will not be able to stop our exposure if there's a cell tower antenna in front of our home. Instead of all of these transmitting 5G cell towers right outside of homes, the Commission is recommending that there be the deployment of fiber optic cable connectivity that goes to the premise, to our homes, and that we have wired internet service inside homes so that people can access the internet safely, faster, and more securely. The New Hampshire Commission also recommends that schools and libraries remove the Wi-Fi and instead use safer technology, such as Ethernet connections, not Wi-Fi. In 2017, the Maryland State Children's Environmental Health and Protection Advisory Council, made up of 19 members, including pediatricians and members of the Maryland government, also had recommendations that schools use wired connections, not Wi-Fi. They recommend also that the state provide suggestions to the public on how to reduce exposure. The California Department of Public Health released an advisory on how to reduce exposure to cell phone radiation, and they specifically recommended in their press release that children's cell phone radiation exposure be reduced. They recommend keeping the phone at a distance, not sleeping with the phone next to your head, not putting the phone in your pocket, and using speakerphone when you use the cell phone. In response to the California recommendations, the San Francisco Teachers Union, the United Educators of San Francisco and California, passed a resolution in 2018. It was on enhancing technology safety so that this important advice on reducing cell phone radiation would be disseminated to all students and staff and teachers. And the resolution also talks about posting the cell phone radiation advisory in all classrooms in the county. There are many teacher unions and educational organizations in North America taking action on the issue of Wi-Fi and cell towers and 5G near schools. Parent organizations have written letters calling for the halt to 5G near their schools. Organizations such as the New Jersey Educational Association have released information on how to reduce exposure to wireless in the classroom setting. Some unions have released reports about the effects of Wi-Fi. The New York State Teacher Union passed guidelines for the safer use of wireless technology. Just recently, the Green Party of California issued a statement on 5G wireless technology. They are calling on federal, state, and local representatives to apply the precautionary principle for 5G. They are calling to reduce exposure and use safer technology. They are calling for a robust, independent, scientific, environmental review of 4G and 5G wireless exposure, and to halt FCC satellite networks on Earth and in space in light of the new findings on climate, pollution, and health impacts. In addition, they're calling to adopt the expert recommendations, such as those by the New Hampshire Commission on 5G Health and the Environment. People are waking up to this issue all across the United States because cell towers are being built right in front of people's homes. People are waking up in the morning to a cell tower being right in front of their child's bedroom window. This is unacceptable. We must raise awareness in our communities on how to use safer technology so people know how to protect their families and protect themselves. And then we must ensure that our communities and our neighborhoods and our homes and schools are protected so that levels of wireless radiation are reduced to as low as possible. And we need federal protections for the public and for the environment.
Did you know that cell phone, the one in your pocket, emits radio frequency radiation? As long as your phone's turned on, even if you're not talking or texting.
The American Academy of Pediatrics in over a dozen countries recommends reducing children's exposure to wireless radiation.
When using a cell phone, I always keep it away from my body. I use speakerphone or a headset like this. To stop microwave exposure, I put my phone on airplane mode and turn off Wi-Fi and Bluetooth function.
I hold the phone at a distance and make sure it's not touching my body.
Cell phones are not toys. Children's brains and bodies are still developing and are vulnerable to wireless radiation. Practice safe and responsible habits with yourself and your children.
When using the computer, I always try to make sure my connection is corded, not wireless.
Remember not to use your cell phone in the car. The phone works at higher power in metal surroundings and bounces around, increasing your family's radiation exposure.
For their safety.
For your safety.
Because children are more vulnerable.
Remind them. Remind yourself.
To limit your microwave radiation exposures. Probably the most important thing I did, I was involved as a young scientist in the committee that actually reviewed the data and recommended that there be no smoking on airplanes. You may be shocked to hear that it was even a question for science at the time, but it was. And when I look at what we know now about mobile phone radiation, I see some very interesting similarities.
A growing number of prominent doctors and scientists are raising warning flags over radiation this morning, and your kids could be facing a greater risk of exposure.
I think the most important study is a study by the National Toxicology Program in a classic large carcinogenicity test, one of the largest ever performed, and for that matter, one of the most expensive. They found increased risk of the tumors which we believe radiofrequency radiation is causing in man. Particular tumors called schwannomas. In the rats, they were in the heart. In humans, they're often in the nerve, the ear nerve, the vestibular nerve.
Cell phone providers say they follow all safety guidelines put into place by the FCC.
The current FCC safety standard was developed nearly 20 years ago.
The manufacturers actually tell people in the instruction manual, which I've never read, not to put the cell phone against your ear.
It does say exactly that. There's the BlackBerry, for example, warns to keep your phone at least 0.98 inches away from the body when transmitting. With an iPhone, for example, it's 5/8 of an inch.
At this point, the evidence has become sufficiently strong that cell phone radiation is a human carcinogen.
A major development from California's Department of Public Health. High use of cell phones may be linked to certain types of cancer and other health effects, including brain cancer and tumors, lower sperm counts, headaches, and effects on learning, memory, hearing, behavior, and sleep.
If it was a real problem, I would know. If it was a real problem, the government would protect us. How come I'm not hearing about this? They're all things I've heard when I give seminars. You know, I get up there and they say, oh yeah, if this was really a problem, they would have told us. I am they. I am a, legitimate scientist, and I am telling you.